washing my hands with hand sanitizer. Hi, my name's Andrea. I'm a family nurse practitioner student, and I'll be examining you today. Can you tell me your name?
Sure, my name's Whitney. It's nice to meet you.
Whitney,
Andrea.
nice to meet you. And what's your birthday, Whitney?
I was born January 20th of 69.
Okay, awesome. And you know where you're at today?
I'm at Research Clinic.
Okay.
Just coming here because I've had some palpitations lately. So.
Okay. Palpitations, are those in your chest?
Yeah, just kind of right here. It just feels like my heart's beating really fast.
Okay.
Yeah, I just never felt like this before.
Did that start suddenly, or would you say more gradually?
No, it's come on pretty sudden. I've just had a lot of stress, anxiety lately, so it's been pretty sudden and it's scary, so I'd like you to check it out today.
Okay, sure. Well, let's talk about when did it start happening?
About a week ago, actually.
Okay. Did any sort of event happen before that?
Like I said, I'm under a lot of stress as my job. I'm CEO of a hospital across town. Didn't want to be their patient, so came to you today.
Okay.
And my husband and I just got a divorce.
Oh, I'm sorry to hear that.
And I'm just kind of an anxious person anyway, but I do have a lot of stressors. So
Okay.
it happened, it started last week, and it's been about twice a day.
Okay. And how long would you say it lasts when it's happening?
Sometimes the episodes are only like 1 or 2 minutes. Sometimes they last as long as 5 or 10 minutes. So.
Okay. And has it happened every day or just a few times in the last week?
I'd say at least 1 episode a day, if not 2 episodes a day.
Okay.
Over the last week when it began.
Okay.
It actually just started when you walked in the door a few minutes now. It's been going on because I don't know if it has to do with anxiety, but I do feel like it's happening right now.
Sure. Okay. And are you having chest pain right now?
No
chest
chest pain. It's just really weird, like rapid and maybe
Feels
offbeat or something. I don't know.
Okay.
It just feels different.
Okay. Any shortness of breath?
I don't think so. No, I haven't had shortness of breath.
Okay. And is there anything that makes it worse?
Well, the stress, as I mentioned,
Okay.
and after I exercise.
Okay.
I haven't been exercising a lot lately because it kind of makes it worse.
Okay. And what makes it better, if anything?
It's just trying to relax, rest.
Okay. So does it seem to go away shortly after that?
If I really focus on relaxing.
Okay. Okay. And how bad would you say, severity-wise, your symptoms are on a scale of 0 to 10, 10 being the worst?
I mean, sometimes it's not there, so that'd be a 0, but it's not the worst I could imagine it being, so maybe like a 5
Okay.
out of 10.
And have you had symptoms like this before?
No, this is new to me. It's
No.
different than anything I've felt, so
Okay.
that's why I'm here today.
All right. And are you having any jaw pain, back pain, or arm pain?
No,
No? Okay.
it's very localized.
Okay. So we're just trying to rule out MI-like symptoms, and since Whitney is a female, she could have more atypical symptoms such as back pain. Women sometimes can have that. Anyone can, but okay. So Whitney, I'm just going to ask you some questions just to get a better feel for your medical history.
Sure.
So have you ever been diagnosed with any disorders at all? Any medical conditions?
No, I'm pretty healthy.
Okay. Your chart showed that you were diagnosed with anxiety in 2009. Do you
Oh, yeah,
take
I
anything
forgot
for
about that. I am an anxious person. Yeah, I take a Xanax at night each evening. I think it's 1 gram every night before bed.
1 milligram? Okay.
Yeah, 1 milligram. Yeah.
Okay. Just clarifying. And then, do you have any history of cardiac disease, abnormal EKG?
Me, personally?
Mm-hmm.
No.
No. A structural heart defect, anything they diagnosed you with when you were younger?
No. I've always been healthy.
No. Okay. Any surgeries in the past? And then do you have mom and dad still?
They're both still living. They're both 75 this year, and both have high blood pressure, and dad definitely has high cholesterol. I think mom might too.
Okay.
But yeah, just little things: high blood pressure, high cholesterol. Otherwise, they're very healthy. No heart attacks or anything.
Good. Okay. Any siblings?
Nope, just me. Only child.
Okay.
And
Any children?
no, that's kind of why we got the divorce.
Oh,
We never wanted
okay.
children, and that has just been
That's
ruining
hard.
our relationship lately. So.
I'm sorry to hear that. Well, let's move on to your wellness history. I see you got a flu shot 2 weeks ago.
Mm-hmm.
Is that correct?
Mhm.
Okay, that was just in your chart. And then when was your last pap smear?
Maybe 6 months ago.
6 months ago?
Mhm.
Okay.
Just a few months ago.
And then when was your last mammogram?
At that same time period, about 6 months ago.
Okay. And were both the mammogram and the pap smear normal?
Normal.
Okay, awesome. And then have you gotten a colonoscopy in the past?
No, I think I have a couple years.
Okay.
50. I'm only 48, so.
Yeah, usually they recommend it at around 50 unless you have additional risk factors for that. So, okay, good. Well, it sounds like you've been keeping up to date with
Yeah, like
everything.
I said, I'm
so
very healthy. This is new and quite worrisome.
Sure, sure. Any medications besides the Xanax? Including over-the-counter medicines or vitamins, supplements?
I'm really healthy diet, so I don't worry about that. I just take the ones you have.
Awesome, okay. Any allergies to medications, food?
Mm-mm.
No? Okay. And then have you ever used tobacco?
No, never.
Smoker? No?
Never.
Awesome, good. And then alcohol use? Do you
Maybe
consume
like
alcohol?
one beer with the girls. I'm not real good. Not a
Okay.
drinker.
How often would you say you have a beer?
Maybe like Friday night, one beer.
Okay.
But I'm
One
really
night.
healthy.
Okay, awesome. Any history of drug use?
No.
No. Okay. And then you mentioned for your work, you're CEO of the hospital, and how that's pretty stressful.
Very stressful. And the divorce.
I can imagine.
There's just a lot going on lately.
Okay. And then you also mentioned your marital status, your husband. So it sounds like you've been going through a lot recently. Well, and then you also mentioned that you exercise, or you haven't been exercising as much.
Yeah, I usually exercise, 30 minutes a day, at least 4 days a week, if not more. I'm super active and fit, but like I said, we're making it worse, so I've not been exercising all week.
Okay. Do you have caffeine at all, including like decaf, soda? How much
I would
caffeine?
say about 4 cups of coffee a day. I know that's
okay.
a lot, but I gotta have it. So
Do you ever go without the coffee, or is it pretty consistent?
it's pretty consistent.
Okay.
At least 4 cups.
Okay.
3 or 4.
And then for diet, you mentioned that you eat pretty healthy. Is that mostly fruits and vegetables, or?
Protein, fruits, veggies.
Great.
I'm not really fried foods, carbs. Like I said.
You stay away from
Yeah,
that.
I like to exercise and I'd like to get back to it, but
Good for you. Okay. And then as far as stress levels go, do you feel like you're managing your stress pretty well, or do you feel like maybe you could
I
work on that?
probably should work on managing that with some yoga or a therapist or something, just with all that's been
Sounds
going on.
nice.
And I should start managing that better, I know.
Okay. And then any exposure to new pets? Have you traveled at all? No.
No pets, no travel.
Okay. Awesome. All right, so now I'm just going to ask you even more questions. It might feel like a lot, but again, I'm just trying to get to the bottom of what's going on with you. So, you mentioned that you drink a lot of caffeine. Have you been feeling more tired recently?
No. Yeah, over the last week, I would say.
Okay.
More fatigued.
Okay. Any recent infection?
Mm-mm.
Any numbness or weakness?
Mm-mm.
No.
Really feel fine other than a little fatigued and this.
Okay. Any nausea, vomiting?
Mm-mm.
weight loss, weight gain? Nope. Any shortness of breath or wheezing? Any cough?
No.
No. And then cardiac, I know I already asked you a lot of questions about your heart. Have you had any loss of consciousness, like you pass out? No. Any chest tenderness or heartburn? No. And you already mentioned you weren't having any jaw or back pain or arm pain. So we go over that just to figure out what's going on with your heart. And then have you had any dizziness?
No.
No. Okay. Any swelling anywhere? No. Any problems with your speech or vision? No. And then have you been feeling like you're sweating more frequently or notice any changes in your skin? Okay.
Oh, sorry, I guess I am fatigued.
That's okay. And so we took Whitney's vitals. Her height is 5'5". Her weight is 115 pounds. Her last menstrual period, she's been in menopause since 2015. Her temperature is 98.6 degrees Fahrenheit. Her heart rate on the machine, which I will later verify by listening to her apical pulse, is 140 beats per minute. Her respiratory rate is 18. Her blood pressure is 110/68, which is normal for her, she said earlier. And her O2 stats are 99% on room air. Whitney is not in any pain at all. So Whitney answers questions in an appropriate manner. She's been cooperative and pleasant. She's dressed appropriately for the weather. And then, Whitney, I'm just going to listen to your heart and lungs, if you don't mind. Okay. Let me make sure my computer can see us here. Oh, it locked me out. Okay. Still going. All right. So I'm just going to have you sit up straight for me. Very good. Okay. Take a deep breath for me. Good. Good. Lift your right arm for me. Thank you. Good. Listen to your back. Okay. So Whitney's lungs are clear to auscultation throughout. There are no wheezing or crackles heard. We made sure to listen to the bottom of the diaphragm, so we're making sure we're getting the bases there. Whitney's not having any coughing, and then we'll listen to her heart. So just going to take a listen here. Make sure I'm not getting away. Aortic, pulmonic, Herb's point, And so in real life, we would listen to Whitney's apical pulse for a full minute. So when I did that, I got a heart rate of 140. It is regular from what I can hear. So I would definitely do an EKG on Whitney, even though she's not having any chest pain. She's having palpitations, so definitely a great reason to do EKG. Whitney's EKG showed sustained SVT, so supraventricular tachycardia, with a heart rate of 140. It did not show any ST elevation or depression, so Whitney's in SVT. So then I'm just going to look you over your extremities here, so that I get you to hold your arms out. So Whitney has good color. Her cap refill, she didn't have the gel nails, are less than 2 seconds, which is great. So you can put your hands down for me. Her radial pulses bilaterally are 2+. And then let's make sure they can see me check the pedal pulse. Okay, so we're looking at Whitney's legs. And both her pedal pulses are 2+, good color. I don't notice any differences in hair distribution on her extremities at all. No edema noted. And she does have less than 2 second cap refill on her toes as well. Whitney's speech is appropriate, so this is just making sure she's not having a stroke. Her speech is appropriate. Earlier, she did not complain of any vision changes, and when Whitney's been smiling at me this whole time, her facial movements are symmetric. So I did also note that she does not appear to be diaphoretic, and she did not complain of that earlier. She does not have any paleness to her skin. She has a nice pink color. She has no ulcers, especially paying attention to her lower extremities. No rashes or any other skin concerns noted. So at this point, I will go over my differential diagnoses. So I would definitely, diagnose her with supraventricular tachycardia. So that was confirmed by the EKG. But her symptoms are common for SVT, including the heart palpitations that she's having, feeling like her heart is beating fast, her increased fatigue over the past week. So those are all common symptoms. Other symptoms that Whitney didn't have per se could be shortness of breath in some patients, dizziness. If they're unstable, they can become very hypotensive, which did not happen in Whitney's case, but it can also occur with increased stress and with exercise, as Whitney mentioned. Her caffeine intake or any sort of amphetamines, some drugs like cocaine can have an effect on SVT. So in Whitney's case, her 4 cups of coffee a day could exacerbate it. So as we said, her EKG showed sustained SVT with a heart rate of 140. In real life, I would refer her to a cardiologist if she was unstable. Of course, we would refer her to the ER, so hopefully she would go there where we would try vagal maneuvers first if she was stable, have Whitney bear down and whatnot. My second differential diagnosis is AFib, which I ruled out with the EKG. Her symptoms are common for AFib. However, her rhythm is regular. Her EKG shows SVT. With AFib, just like SVT, sometimes it can come and go, or patients can stay in it, but we ruled that out. And then lastly, we rule out MI and stroke, but we can only have 3. So Whitney denies weakness, chest pain, heartburn, jaw pain, nausea, vomiting, shortness of breath, or diaphoresis. Since she's a woman and a lot of patients, man or woman, can present with jaw pain, back pain, or arm pain. We ruled this out in Whitney. Her EKG shows SVT again, no ST depression or elevation. And lastly, she does not have typical risk factors for MI, including hypertension, hyperlipidemia, obesity, or any cardiac history. So we would want to get Whitney to a cardiologist. So, Whitney, do you have any questions for me?
No, I don't think so.
No? Awesome.
Glad it's
All right.
not a heart attack.
Yeah. Yeah. And are you feeling better right now?
Yeah, it went away halfway through, so
Awesome.
it's the craziest thing.
All right. Well, like she said, hers lasts about 5 minutes. So, all right.